Assalamu alaikum. This presentation is on dog ear deformity, that is puckering of the wound edges, either unilaterally or bilaterally, while suturing the wound. Sometimes this is inevitable, like when you are doing local flaps, either rotation flaps or advancement flaps. But in most situations, this can be avoided with good planning of the wound geometry and with good suturing technique. And this presentation will start with the measures that should be taken to avoid the formation of the dog ear in the first instance. We'll go through the causes of dog ear formation and how to classify it, a better way of designing the wound, application of the rule of halves while suturing the wound edges, and techniques to spare tissue like the M-plasty or the inverted triangle excision, and other techniques for better orientation with the local anatomy like in the S-plasty. Dog ears are formed when there are excess tissues on the wound edges that are raised up above the surface of the wound edge itself. This bunching up of the excess tissue, of the puckering of the skin, is called the dog ear. Sometimes it affects only one side of the wound, then it is a half cone like in this picture, or sometimes it can affect both sides, then it is a full cone dog ear. Occasionally, excess subcutaneous fat under the surface of the wound can cause a raising up of a part of the wound, giving a pseudo dog ear. This is different from the dog ear we are describing as a full cone or a half cone, and have a different way of management. There isn't a better name for dog ear that is gaining popularity, and most reports now refers to the condition with the old name dog ears, although it's not ideal, particularly when you are discussing it with patients. But names like a pucker or a tricone has never gained actual popularity. The first type of the dog ears are the full cone dog ears formation. That's the much more commoner of the two. Almost 80% of dog ears are full cone. They usually develop because of excess skin at both sides of the wound. As you see, we're trying to remove a small lesion here with a safety margin. But if the wound design is circular or it is elliptical but with a length-width ratio of less than 3:1 or even 4:1, and if the angles at the apices of the excision are more than 30 degrees, then you end up with things like this. You end up with the puckering of the skin at the edges. The best way to avoid this is to try and design the excision of the wound like in a fusiform or an elliptical, and that would entail excision of more skin at the corner, so that you end up with an angle here less than 30 degrees and a length to a width ratio of more than 3:1. This type of deformity can also develop if you are using excessive tension, particularly in the center of the wound where the gapping is more, because this will flatten off the central portion of the wound and will raise the edges, causing dog ears at the two sides. But it's inevitable if you are advancing or rotating local flaps to have dog ears, and there are ways like Barrow's triangles to sort this out. The other type of the dog's ear are the half cone. They usually develop if there is asymmetry in the wound geometry, if one side is much longer than the other, or it's asymmetrical in other ways, or even if the distribution of the sutures along the wound is not symmetrical. This would cause the half cone. It's less common than the half cone. About 20% of dog ears would follow this. And now see if we are folding trying to stitch, this asymmetrical ellipse, you end up having excess tissue at one side. That's the half cone here. And because you have this excess tissue, you would need to remove a small piece. This is the triangular part of the skin that would need to be excised to bring about a flat wound and remove the dog ear. This triangular piece will be removed, and if this removed, then you end up with a fairly symmetrical ellipse. So the best way of avoiding a dog ear formation is to try and shape up the margin of the excision like an ellipse. You'd see here the lesion is being marked with a safety margin, and this is going to be removed. And once this is achieved, you cannot really suture this wound without forming dog ears at the two edges. So you would have now to design the margin of the excision in order to get this, in order to avoid having these two dog ears in there. The way to do it is to design a fusiform shaped. It's not really an ellipse because it has angled apices. You would see that the design here is a length to a breadth of more than 3:1 and an angle, apic angle, less than 30 degrees. And this would entail removing of two triangular pieces of excess tissue in the wound plus the safety margin, but that's to get a flat wound, avoiding having the dog ears at the end. Remember that on designing this ellipse, you would have to respect the local anatomy, and you would have to try and place it as close as possible to the relaxation skin tension lines. And if that's not possible, at least avoid having the orientation perpendicular to any nearby relaxation skin tension lines. The other simple thing that can be done to avoid a dog ear is to apply the rule of halves while putting your sutures in the wound. This entails trying to figure out where is the midpoint of the two sides to join them together, and then going from there to the midpoints of this segment and the midpoint of the other segment, and between any 2 points find the midpoint here and the midpoint there to join by suturing. One thing that you can add to this is start by doing a suture at the two ends first before starting suturing in the middle. If you have a suture at one end here and one end on the other side, then you would avoid having the dog ears at the edges. That's the commonest side where you get the dog ears. And then you start in the middle after this, and then go back and have another suture here and another suture on the other side, and keep doing this, putting your stitches midway between any two stitches so as to bring about even distribution of the sutures and the tension along the entire length of the wound, but you have secured the angles by placing first lateral sutures. The problem with the elliptical or the fusiform design of the wound is that you lose tissues in addition to the safety margin at both ends of the wound in order to keep the dog ears from forming. Techniques were developed to spare these tissues from being removed unnecessarily and still keep the wound flat with no dog ears at the end. So that's the conventional fusiform shaped, which is 3 times more length than width and acute angles in there. Now, this is how to form the M-plasty. You want to preserve this small piece of skin at the edges, and without removing it with the rest of the lesion and its safety margin. And on doing this, it's like forming an M shaped here with its apex at the edge of the safety margin. And then you would remove that central portion of the wound, and you have spared two rhomboid pieces of skin at both ends of the wound that would have been removed if you just do the conventional ellipse or fusiform wound. And it's still very safe because all the safety margins were included in the central portion, but you have this M-shaped formation at the edges. Now, if you try and suture this wound, you end up having a flat wound, and the rhomboid shapes will be sutured at the tips in here, so you get a central portion of the wound that is much shorter. You have two small tails at both ends. The other simple technique that can be used is the S-plasty, which is not primarily a tissue sparing technique, but it's a wound reorientation way of putting the excision margins in respect to the local anatomy, particularly on convex surfaces. If you want to avoid a wound that's going on a convex surface like an ellipse, you can place the S-plasty on this, like over the nasal bridge and over the chin. This is a way of reorienting the wound. Now, so long as you keep the length and the breadth ratio like 3:1, you don't have to mark a truly ellipse wound. You can have it like a gentle S wound, S-shaped wound, that will still have the lesion and its safety margin around. And you can add an M-plasty at the two triangles at the end, the extra triangles, so you could spare tissues in here and in there. But by having the wound in a different orientation, you could place it in a fold, or you could redistribute the tension between the two crescent shapes of the S-shaped in a better way than an ellipse. This is how you would just go along the combined S-shaped excision and M-plasty as well, making sure that you have removed the lesion, which is with its safety margin. You are left here with a small M-plasty on one side and another M-plasty on the other side. Another tissue sparing technique is to avoid using the traditional elliptical design. Instead, once you have marked the lesion and its safety margin, you draw two inverted triangles, one on each side of the safety margin. And by excising these inverted triangles, you could actually bring about the wound to be flat. This point in the triangle would come in here, would be sutured like a 3-point junction or a corner stitch in here, and you end up having a smaller piece of skin excised plus the safety margin. In comparison to the M-plasty, it ends up with a similar type of wound because you have brought the middle portion of the triangle to lie at the apex of the wound. So you end up having a central part of the wound that is small enough and two small bifurcation at the end, much like the M-plasty. So here you are removing this small piece of triangle with its apex on the safety margin and its base away from it. We've removed it on this side and we are removing it on the other side. And once this is removed together with the safety margin area, this wound can be stitched flat. You have too many corners in here, and so you have to be extra careful while suturing this wound, but it is helpful sometimes if you want to spare tissues near the inner canthus or in the eyelids or beside the lips. We've been through how dog ears are formed by excess tissues, either a full cone or a half cone, or a pseudo dog ear by excess subcutaneous tissues. And we've been through techniques to avoid having dog ears, like the elliptical fusiform shape of the wound, the M-plasty, the S-plasty, and the inverted triangle. Salam alaikum.